I'm so technologically challenged.
Hey everybody, Dr. King here with the All-Star Podcast. I've got Dr. Dudley, Dr. Cloud with me today.
Hey.
As we know, just on course everywhere. We just want to welcome you today. As you know, Katie Ray has moved on to yoga life, being a yoga
Good for her.
Zen person. Oh my gosh, this is what happens to me because when we'll just turn that all the way down.
Technologically challenged too.
Yeah, exactly. So I thought it'd be really fun to have you guys on the podcast so we can talk about some of the things that we talk about during the week. Be sure to catch us on YouTube. He always has to correct me the entire time. YouTube, Spotify, all podcast services. Send your questions to allstarpodcast@gmail.com. No. ASVCpodcast@gmail.com. And we
need Katie Ray.
Oh, yes, exactly. I'm like the sidekick typically. And we'll answer questions and anything you want to talk about. We are happy to answer questions. So here we are. So one of the questions that got asked this week by a lot of owners because of a bunch of information on the oral flea and tick stuff, right?
Yeah.
That was one of the things we were going to talk about.
Yeah, fielded so many questions about Simparica, its safety, its use. I think there was a lot circulating out there about on the news and Facebook.
And I'd say it's not necessarily just about Simparica, but all the orals.
Yeah, no.
All the oral flea and ticks. So we got Simparica, NexGard,
Credelio, Bravecto, that whole isoxazoliners class, as they call it.
Yeah.
I think a lot of people concerned. Even though I feel like most of the doctors here feel pretty comfortable in using it.
Yeah.
Yeah.
I use it. Do you use it?
Me too. Oh, yes. Apollo is on it. He loves his monthly chew.
So what was the primary concern? I think like in the articles they're talking about neuro effects, right? I mean, that's where everybody seems to be focusing their attention is on seizures, tremors, trembling, anything neuro. Right?
Pretty much.
That's where they're getting written up or talked about.
Yeah.
Have you seen the articles about that? The posts?
I've heard about it.
Yeah.
I thought it was last year's news. I didn't realize it had come back around.
Yeah, there was a recent, like either resurfacing of a Facebook thing or something.
Yeah, I think a video kind of popped up about a dog having some seizures, and I mean, that's scary to see. I think anyone that has a dog that seizes, I think it's a
and you're looking for a
sight.
reason, right? I mean, like you want to find out why.
So you want to
Just
know.
gave something.
Something.
Right.
Yeah. So, but I think that with the safety and the pharmacovigilance, I can never say that fast enough, but those studies for those drugs, I mean, they all are very safe.
Yeah.
I think that Simparica itself, we were talking about it on Friday. I think the incident rate of issues is like 1 in 10,000.
1 in 10,000.
And of those that one,
it's like number
percent,
5
it's like
or
number
7,
5, yeah.
something like that. Yeah, no, I feel very safe in using it. I've never seen an adverse event like muscle tremors or any of that come from Simparica.
The Simparica use. What do you think about, because I heard you talking on the phone to a client earlier, explain to them how Simparica works with the GABA receptors, because you were explaining it really like nice, like layman's terms. Like you were like, okay, GABA receptors are this, and then Simparica only binds 1 for every 270. Like explain that, like how did you get that point across to the client that the neurologic component, like we're not worried about Simparica from a neurologic standpoint of things?
Yeah, so I think it kind of goes back to the physiology of the animal and there's little receptors that are in the brain that kind of control how everything works. And I kind of explained that, we're talking about trying to bind to those receptors. Our goal is to bind to them in the insect. So in that instance, we're trying to bind to them in the flea and tick, what we're trying to kill. And our goal is not to actually bind to the same thing that's actually the equivalent in a mammal.
Right.
And so we really look at those numbers. And so for every 1 receptor it's binding in the mammal, it's binding, I think it's like
277. Yeah.
277 in the insect. So at first that seems like, oh, that's...
It's binding,
Yeah,
period.
it's binding. That's scary.
Whoa, yeah.
But if we then look at that in comparison to some of our other flea and tick preventatives, some of the topical ones that have been on the market for who knows
So yeah,
how
talk about like
long.
Frontline.
Yeah.
Because that's a really common one because you can buy it over the counter.
Right.
People are like, oh, it's been around forever. It's safe.
Right, permethrin.
Let's just use it. It's safe.
Yeah.
So the binding rate for Frontline, for instance, is
1 and 2.
1 to
So
2, right.
Really, you're potentially hitting more of those GABA receptors, but honestly, Frontline's a safe product as well. So
Right.
really, the selectivity, because we're using such low doses, because think of how big an insect is. Jiminy Cricket, we can kill them with a tiny amount, really isn't affecting our patients in the least.
right. So I think on the label for Simparica, it says use with caution
Yeah.
in pets with seizures.
Yeah.
So that is use in caution. I think they're the only ones that have that label from the standpoint of everybody else says do not use
Right.
in patients with seizures. So they're at least the FDA, based upon their research, found that yes, you could use in caution, which means you can use it.
Yeah.
You just need to be cautious about how you use it.
But doesn't that go for pretty much any drug? I mean, those
Right.
those
Yeah.
commercials, and the side effects include
depression,
death,
suicide,
bloody stools, all of it. Like, I mean,
it makes you want to not take the drug, right?
Right.
Right.
You watch those and it's like 20 things. You're like,
Yeah.
never mind. I feel
Yeah.
pretty good right now. I'm not going to worry about
I
it.
mean,
Yeah.
that's any drug for you. And so we weigh out those benefits. What would we rather have? And in this instance, the incidence rate is so low, 1 in 10,000, but we are getting the benefit of, first of all, your house isn't infested with fleas, number one. But even more importantly, we're getting rid of ticks, which can transmit diseases to us and can cause a whole
Right,
lot
all those
more.
tick-borne diseases, which are really
Yeah,
becoming more
systemic
prevalent.
And problematic. So, Carla, speak to off-label use. Anything in general. What do you think of off-label use as far as our industry goes?
Like
Do
this-
we use
Yeah,
things
we
off-label?
do use them off-label. I think that a lot of times it's helpful, but you have to let the person know that you're using it off-label. and
So do
why
you-
you're using it off-label.
Right. So, do you think that you have enough drugs in your tool cabinet that are on label for veterinary medicine? If you're treating a vomiting patient,
Oh yeah.
right? You use a lot of drugs off-label,
Yeah.
like a gazillion.
Yes. Most.
Right?
Most.
Most.
Most
Right.
are off-label. you
Right.
know.
Yeah, because you don't have
But,
enough support.
Yeah,
like,
there's a few that you can use and
Right.
we do readily use, but I think a lot of times we use a lot of things off-label.
right.
Thank you, Amduca.
Yeah.
Yeah. So yeah, I mean, it's just such a. I don't think we'd be able to practice as good of medicine that we do without being able to
No,
use.
no,
If they were like,
any-
you can't use anything off label, then we'd be like, I don't know, we'd be stuck.
Can't,
A lot of
can't
things,
help anybody.
and it would be horribly expensive
Yeah.
for pet owners across the
Yeah.
You
board.
have to only use like name brand and it would just be crazy.
Yeah, so I think that's another question that's been brought up in the past, in regards to off-label use of different products.
Right.
So
I think a lot of stuff is off-label. It's just as easy.
it
More
is.
helpful.
It is, exactly. Oh my gosh. Okay, so today you did surgery today.
I did do surgery today.
Tell everybody about what you were
I did
doing.
a foreign body. It turned out to be like this little octopus. It was an octopus.
It was,
Katie
yes.
Roberts was like, that looks like an octopus. And I pulled it out. It was an octopus.
Oh my
Impressive.
gosh.
It's nice.
Yeah.
So
It went down the hatch and
it went down the hatch and got stuck about halfway. So
Yeah.
hopefully.
it was really dragging in there. It was like,
It was like really, yeah.
So-
it was pretty purple in there.
her little intestines weren't happy. So what'd you do?
Oh, so is this? Do I look at that, or do I look?
I
at
just
this?
I just talk.
Do
I don't
Where
necessarily
am I
look at the
supposed to be
camera.
looking? Do I
Yes.
feel like I'm ignoring them?
No.
The world. So then I just did an anerotomy and I was able to pull it out and then sewed it all up and then watched it, made sure everything looked happy, checked the rest of the intestines. There was no other little octopi in there
Okay.
that I had to remove. So hopefully the dog's recovering now. So hopefully
What's the weirdest thing you've ever pulled out of an abdomen, of an intestinal tract, of a GI tract?
the weirdest thing, lots of pacifiers, corn cobs.
Corn cobs are like the worst.
They are the worst.
They like
always
drag,
get stuck,
like
come out of the stomach and then get stuck.
and they're
right
just
there.
like the outside is
Yeah,
like
it's easier to get adhered.
yeah, like textured enough that
Yeah.
it just
Yeah.
stops.
The cat with the earbud. It was like a perfect
Oh
earphone
yeah,
earbud. That
an
earphone-
earbud headphone.
Right
Yeah.
Birdseed dog.
Oh, the birdseed
Birdseed
was the
dog.
weird one.
I mean,
yeah,
that
that
was something-
I've never seen impaction in a dog.
No, I hadn't. Well,
Like
I
that
had
caused
seven then.
like foreign body impaction. Like
Yeah.
you hear about it like right in horses and all that stuff.
Yeah.
But that
It
was
like
the
7 inches of impaction.
of impacted birdseed.
Yeah.
So
It's
just to
gross.
clarify, little dog ate so much birdseed that it got all congealed and created a foreign body in the
birdseed.
of just straight up birdseed, and that
There wasn't
created-
enough water, like, right? That we were
got
using that
dehydrated.
sand, right? Yeah, we were using that sand analogy where you can add enough water to sand that it flows or it moves or becomes liquid.
Yeah.
Or you
and
can create a sandcastle in the
right.
dog's intestine.
That's exactly what happened. It was a sandcastle in the dog's intestine. Yeah, that was pretty crazy because you guys were just like, "There's more. There's more."
One time I took out like old school telephones, you know, like the curly cord.
Oh yeah.
A cat like ate a chunk of it.
Oh my
I'm
gosh.
gonna take that out. You don't see that anymore.
No, nope. You don't have to worry about that anymore.
Telephones don't have cords.
Nope, not at all. Now you just get cell phone batteries, or batteries, and then cell phone covers and all kinds of stuff. Earbuds, exactly. Oh my gosh, I had one dog one time that it ate so much stuff in his stomach that it was like an American bulldog or whatever, and it ate so much stuff in its stomach that once he was anesthetized and you laid him on his back, his stomach was like pushing up, like so you could see like his stomach through his wall. You know what I mean? Like
Oh
where you're
my
like,
goodness.
oh my, there's a lot in there kind of a
Right.
thing. So we opened it up and we pulled out socks, multiple pairs of socks. This guy's dress socks, pantyhose. I mean, it was just like all sock
Do you know what I'm thinking of right
footwear.
now?
What?
Bad Betty.
Bad Betty.
I have a beagle and she eats everything. She always has something in there. She's always
does.
puking up something.
Tell
Betty-
them what they ate this weekend.
Well, this weekend that we know of, she ate a Nerf dart and then a dinosaur foot, his tail, and part of his arm. My son was
Not happy.
pleased.
Oh my gosh. So
Not
now.
pleased.
So, but with Betty, is Betty still being fairly predictable in terms of
Yeah.
presenting with obstructive behavior? So like she does that weird thing where,
Yeah, she like licks everything
Yeah.
and then she vomits it up and then she moves on.
yeah.
So
But Betty's here
next
today because she's
portal.
having her teeth
yeah,
cleaned.
she's getting her teeth cleaned, her breast stinks.
So Carl's getting ready to do her teeth and extract a tooth, maybe.
Probably.
You think?
Extraction. Yeah.
So you're on call. You're waiting for the treatment department to call you.
Hopefully Bad Betty's okay.
Vomits up that nice dinosaur.
Exactly.
She didn't vomit up anything.
It's all,
Preemptively.
oh, she didn't.
No, I had him give hydro just in case.
Right.
But
So, and then today was the first day of the kids going back to school.
kids went back to school.
So you
Very
also had that
excited.
this morning.
Yes, and I have to get them off the bus, make lunches, all that.
So
Wake them up.
do they take their lunch every day?
So they can get their lunch at school, but after last year, after a couple of times, they're like, you know what, the school lunch isn't really
Not
that
that
good. Can I
good."
have my lunch from home? I'm like, yeah, sure, that's fine.
So every day lunches
Yes.
go out,
Lunches, water bottles, backpacks, classes,
and then the bus.
and then the bus.
Yeah.
So it was good. They're
Good.
excited. They're ready.
Good. School's starting. Back to routines. Harrison, anything important? Okay. Okay.
Work must go on.
So yeah, work must go on. Exactly. So is the life of a working mother.
Yeah. I mean, it went well.
Is Calvin going back to school?
On Thursday this week. So yeah.
Is he excited?
Yeah, he did this video yesterday for Harrison. He wanted to do a video because we were shooting some other stuff at the house, and Calvin was like, I need to do a video. And so Harrison's like, okay, sure. So Harrison puts him in front of the blackboard, and he had on his school uniform because we were shooting this one video for this other thing. And so he had on a school uniform, and Harrison goes, all right, go. And he goes, my name is Calvin Jared King. Is that what he said? My name is Calvin Jared King. I am going to be in 2nd grade. I am very excited. We were like, okay, where's this coming from? But originally it started out where he's like, Mom, I'm going to have Harrison put me on video because this is what I'm going to say. I'm going to put my All-Star shirt on and I'm going to go, welcome to All-Star Veterinary Clinic. My name is Calvin. How can I help you? And I was like, that is perfect. Can you do that again
Yes.
for me? And so then we videotaped him doing it with his All-Star shirt on because it was really cute.
Summer job next year.
Summer job. He's going to open doors.
Yep.
Of course, he'll be too distracted. He'll be doing everything else. He creates more of a tornado behind
Yeah.
him than anything
Thought
else,
that counts. He tries.
I suppose.
Yeah.
Oh my gosh, no, it's a lot of work. So, okay, what else do we have going on? What else did we have last week that was of interest? Anything else that we were working on last week?
Pulled a cool pin out of a cat on
Oh
Friday.
yeah, that fracture repair.
Yeah.
That one, that was like 2 years old, 3 years old.
Like a leg pin?
Yeah.
So
Oh,
no,
not
well,
like a
so the pin was placed in 2012.
That's when it was, 2012.
Yeah.
I knew it was a long time ago.
And the cat came in because it had a like little scab over its hip.
Oh, no. It migrated a little.
And yeah, so uncovered the scab, and there was a nice little wound, and we took an x-ray and could see the pin had backed all the way out, and all we had to do was press on the skin, and there was the pin. So pulled it on out and made the cat feel a whole lot better.
That's so cool.
Yes, it was cool.
It slid out easily. Like,
Yep.
Yeah, I was shocked. No, she was not. So
I was like, just pull it, pull the pin. And she's like, do we need to? And I was like, no,
I thought-
it's loose. It's migrating out. Let's just pull it. Like, you just pull it. That's what they
Yeah.
tell us. We just pull the pin out. You don't have to anesthetize them. You don't have to do. And yeah, she's like, no, but really. And I was like, no, it's okay.
well, you pull it. No, you pull it.
Well, Allie, one of our surgery technicians, was like, I wonder if it's like a toothpick and a potato. You can't just pull those things out.
Yeah, exactly. Well, I was like, well, if it's threaded at the end,
Yeah.
like I was explaining that sometimes you'll leave a pin in, and because it's a growing dog, so you run it out through that greater trachea, that space right there by the greater trachea, and it's not really going to cause any trouble from the healing standpoint, but it's going to form a seroma, and eventually you're going to have to remove it. But you leave the pin longer because it's growing and you don't want the pin to disappear.
Yeah.
So then in those cases, like 6 or 8 weeks later, you pull the pin. That's how I was like, I knew about doing just pulling it, just pulled it. So
Pull it.
yeah. So that was pretty cool.
I'm feeling way better now.
Yep. No more seroma.
Couldn't imagine having a piece of metal like
It's just like
sticking
every
out
time the
of
cat
bottom.
moves, right, his leg is just going rubbing underneath there.
Oh.
Yeah, on your skin
Just
and
makes you
sit
hurt.
down and I'm sitting on my pin.
I'm sitting on my pin. It's forming a seroma.
There's that thumbtack right there.
Like, oh, let me scoot over. Yeah, exactly. Oh my gosh. So yeah, that was a cool case. Yeah. What else do we have? I'm trying to think. Let's see. Anything
Wednesday
else?
was a big day. We had a big day on Wednesday. You weren't here on Wednesday.
not here on
You missed
Wednesday.
it. Wednesday was exciting. We had lots of surgeries, the dental, cystotomy,
It's been cystotomy season.
two
many
Stone
bladder
formations.
Yeah.
Yeah. That which is a common problem, but there's been a plethora of them.
yeah.
Much
many
to Dr.
bladder stones.
Duckwall's. Yes.
It's getting good. So,
Yes,
I mean,
exactly.
it's
Exactly.
fast.
Yeah, I know.
and out.
In and out. Yeah, exactly. So, okay, Harrison. I didn't see you behind the light. What else do we need to talk about this week?
I don't know. It's up to you.
Other things you can think about?
I don't know.
No, you can't.
I mean, I'm not a doctor.
So we have some cool news otherwise. Terry let us know that we
Oh,
got
yes. Good idea. Let's talk about that.
we got approved for to be administering a program called This Is How We Roll, which comes from Purdue. Yeah, so it is a curriculum based around helping kids get involved in veterinary medicine, and it's usually for younger kids, but honestly we can change the curriculum to meet older kids' needs too. And so we've been certified to help administer that program, and those supplies should be coming this week. So we'll have a bunch of activities to do and potential community outreach that we can
What's
do
the
too.
target age?
So usually it's starting at kindergarten age, working up through about elementary school, but most of the activities are geared towards that. But you can take those activities and make them more complex. So things like anatomy can easily be converted to make it more
Yeah,
challenging.
you just go more in depth.
Right.
Yeah.
But yeah, they have the actual, which is nice because, we've done the tours for
Right, forever.
forever, but this would actually give like the same information, and then we could also use it like actually for community outreach and things like
Yeah.
that. So that would be
That's
really cool.
That's a great age. Like, kids love that. So.
Oh
Awesome.
yeah, and they actually, when they're doing it and doing activities, I think they get a lot from it.
It's
So
hands-on.
yeah,
Yeah, that's cool.
I know. I'm
Congratulations.
so excited.
Yep.
So
Awesome.
that came on Friday. So that'll be our big thing to start up with. And hopefully we get it in time we have a Girl Scout troop coming the first week of September. So
yep.
hopefully it'll be in by then, and then we can start.
Yeah, look at
Vamping
it,
that.
make your plan.
Make a plan.
Yeah, exactly.
But it should be a neat program because it's everybody's into the STEM stuff right now,
Yeah.
so it'll be cool.
Even cooler is it has the specific learning curriculum attached to each lesson plan, so you could theoretically take it into a school, and then it meets the learning objectives
For Indiana, right?
Yeah, for Indiana.
Yeah.
So there would be the possibility too to help out with schools. which I thought was
That's
kind of cool.
fun. Yeah.
Yeah, it is cool. And Terry Russell and you have been really, important in getting that implemented, and it's such a good, like I said, I mean, it's a consistent program. We get the same information out there and it's fun.
Yeah.
So you guys have done a great job getting that thing ready to go.
Now we just need a bus like Purdue has. That'd be even better.
Oh my God, that'd be hilarious. Oh my gosh, could you imagine? We need a bus and we need the mascot, Harrison.
We have Pickles. Isn't she our mascot?
Pickles can be the mascot. Yeah, she'd be like, seriously, another trip.
She loves people.
She does love people. She is good. Yeah. So, yeah. So it's gonna be cool, especially with the school year starting.
Yeah.
Yeah, there'll probably be a lot of groups then, just with everyone kind of getting back into the swing of things.
Yeah, coming back in. Yeah, because we always take a break during the summer, so then pick back up. Okay. I'm trying to think.
What else happened last week? So long ago.
It really is, though. I don't even half the time remember what's been going on.
Isn't that interesting that you do that as, like, I think, especially in our job, that if you don't do that, then it's hard to be available, like, mentally for the next thing.
Yeah.
So, like, you move on, like, so that you can then be, like, so your brain can be ready for the next thing.
Yeah. Well, I think also, like, family, like, on the weekend, like, you can focus on your family. Then you've been so focused on them, and then you come back on Monday and you're like, oh yeah, okay, now I'm focused on
this, right? Yeah, I think it's hard. I think that our job anyway, can be challenging because you're dealing with the emotional aspect of the pets, but then also the people. So it's interesting how you compartmentalize that and move it over here and then focus on this.
Yeah. Bring it right back.
Yeah.
Minute.
Okay.
Let's do it.
Especially for you. I mean, granted, you kind of go in and out, so I can only imagine how that feels. I go 2 days over a weekend, and I'm like, whoa, that seems like so long ago.
Yeah.
Has it been a challenge over the years, or do you feel like you're now so used to it that...
It was the hardest going full-time, left that, and then came here and went 1 day a week and a Saturday. That was hard.
Yeah.
Because I just started all this stuff, and then I never finished it. I just, like, passed it on.
Right.
Here you go. Monday.
Right, here you go. Have fun with that. I forgot that you did that in the very beginning.
Yeah, it was just 1 day a week.
Tell people how long you've been here.
7 years in April.
Yeah.
Wow.
My kids were 9 months.
Yeah.
How is
Oh
it
my gosh.
functioning?
How were you doing that?
Know.
I know, you look back and it's like, how did I even survive that area? I mean, you had twins, so then it was like, how were you even sleeping? Were they even sleeping by that point?
Like Cheerios? Is that what they survived on? I don't even remember.
Yeah. Oh my God. Yeah, that's a lot.
Yeah.
That's so funny. 7 years. Yeah. It's craziness. I forgot that that's how it started.
Yeah. It was just you and I. I worked 1 day, and then we switched Saturdays.
That's right. Oh my God. So then was I off on the day that you worked?
Yeah.
See, we only had one veterinarian in the clinic. I know. Isn't that crazy?
All
To think
day,
about
like
that?
on a Friday.
Yeah.
Man, I don't know if we could do it nowadays.
Oh, you
No,
couldn't.
no,
It would be
no.
impossible.
Yeah.
Like, and that's so interesting because that's only been 7 years.
Yeah.
To think of the changes that have occurred in such a short time period. 7 years, it doesn't feel like that long.
It has been.
No.
No.
But really rapidly changing over the past 3 from a workload standpoint or from the amount of
Right.
people that we've been able to help. It's crazy.
6 doctors. 3 every day.
At least,
Right? Is
if
that what we have,
not.
3?
See,
We're
because no,
pushing
you have
on
like 4
Yeah.
every day because you have somebody doing surgery and then 3 people
that's
doing
right,
appointments.
Yeah.
Yeah.
But like 3 always seeing appointments.
Yeah. That's
Yeah.
crazy. Would you have ever thought? I don't think I would have. I look back at the old, like, think about how the old business ran and worked, like, in terms of how it looked.
Yeah.
And I'm like, that's hilarious, actually. Like, that was where phones were answered.
People came in.
People came in,
Scheduled appointments.
and then we had those 3 rooms and a bathroom.
Right.
And then you went back to
And then
surgery.
you got crazy and you made the bathroom an exam room. Remember that?
Oh, my God. Yes. I hated that exam room.
Yeah.
That was the worst because I always remember I just felt like I was in the toilet the whole time I was in that room.
This is a bathroom.
I'm like, this is not an exam room.
notice,
No, they
but,
didn't
like-
care. But it was like, every time I'd go in there, I'd be like, I hate this room.
Right, it just
And I would
seems so
say it out
crazy.
loud, and the owners are like, why? What's wrong with it? I was like, it was a toilet. So,
Where you're sitting right now,
Yeah.
that's where the toilet was.
oh my gosh, it was so funny. Yeah. Oh boy. And then the whole treatment area, surgery treatment was treatment.
One
That's where we hospitalized patients and did everything.
in one area.
And then it went back to boarding where it was super duper loud.
It was always loud.
Yeah.
I can't believe those kids didn't wear like the
Oh yeah. The
ear
noise.
protectors.
Yeah, no kidding. Wow. It was crazy back then. We would be doing, like, getting somebody ready for surgery, somebody come back for anal gland expression, somebody be in that little space between the
doors,
door
the
and
table.
the table trying to restrain a dog. Oh, my God. But you know what? It didn't feel so bad. Now I can't imagine doing it that way.
No, I mean it works.
But, yeah,
we
that's
didn't know any
fascinating.
different.
You're exactly
Now we
right.
know.
Now we know.
What you don't know.
What you don't know, exactly.
Yeah.
Now it's like, ooh, yeah, this is so much better.
Yeah.
From a
Everyone's
workflow
tripping over
standpoint.
everybody.
Right.
So then where do you see the practice in the next 7 years?
Oh, I don't know. Somebody else asked me that the other day. That's an interesting question because I'm a big like dreamer. Like I'm like always coming up with ideas and throwing stuff and seeing what sticks on the wall, you know.
Yeah.
And so, you know, I'll think about something and then that's the idea for the week and then it'll come back around and revisit me like 3 months later and I'll be like, okay, yeah, this is probably a legitimate idea because I keep thinking about it. But I see, you know, just you know, maybe something. I really would like cats to have a separate area.
Yeah.
You
Away from
know,
the barking dogs.
which is hard because cats, if we're just talking from a business side of things, cats, you know, for the square footage that you have for them aren't paying for the business. You know what I mean?
Yeah,
for
we
the
don't
business.
see nearly as many cats
Right, as dogs. And so then that makes it tricky to justify funds for certain, but at the same time, you want to be able to provide it. And so it's like this balancing act,
Right.
you know,
If
so.
cats are more comfortable, then people might bring them
With
in more.
that's my thought, is
you
that maybe
know,
they bring them in more.
'cause it is very stressful, not just for the cat, but for the owner and the family. And then when they go home, the cats are
So
still
stressed, and
then
the
they're
other cat
hiding,
doesn't
and-
like the other cat that
Yeah,
came to the
it's
hospital.
just- cats are very special
They're
creatures.
special. They're special. No, they are special, actually. They just need to be managed a certain way.
Yeah.
So I could see maybe something like that. I don't know. There's so many different things that I think that the industry is changing so rapidly
Yeah.
that and how people operate, meaning our clients, how they operate in their daily lives is changing so dramatically. I mean, like, who would have ever thought that people's habits in regards to how they operate with Kroger, for instance, like Kroger
Yeah.
Click List, who would have ever thought that people's like behaviors of going to a store and shopping would change so dramatically with Click List and how quickly their habits
Oh
change.
yeah, you do it once, and you're like, oh yeah, I'm never going.
I'm
to
a
the store
fan.
with
I'm
French
never going
kids ever again.
Right. And you know, and so I mean like things like that where time becomes a commodity where, you know, if you can sell time back to a client, I think that's where you know, you're going to have value for them or add value for them. So I mean, you know, there's all of those things that are shifting within the industry as well as, you know, private equity companies purchasing practices to how people consume information, you know, or telemedicine.
Yeah, telemedicine's a big deal.
I mean, you know, so how is telemedicine going to be regulated in the state of Indiana? I mean, we don't have anything good right now to tell us what to do or not to do with it.
Yeah.
I mean, we're all practicing telemedicine to some degree right now because we text pictures.
Right.
We
Or
say,
answer
hey.
questions on the phone. I mean,
Right.
Yeah.
that's technically.
So, you know, I mean, I could see that could be a potential. There are some states where there's groups doing that, like where you can call in, or I know, like, so like I use pediatrics a lot as a way of measuring like what's coming or what are people doing, like to tell us what our industry might be heading
Yeah.
towards. Because again, their patients don't talk.
Right.
So, or if they do, then they're really smart. But
Just screaming.
that's screaming, right? So, what are they doing? Well, they're doing these things telemedicine-wise, meaning exams and whatnot, and making recommendations. So, how are they doing that? Their patients aren't talking. Well, they have an advocate; it's their parent. Well, so does our patient. So, what does that look like? How does that work? I don't know. I just know it's got to be on our radar.
Right.
Um,
In some form.
What do you to put the question back on you guys? What do you guys want to see the practice do? What are your dreams?
What are my dreams? More dentals.
More dentals. There you
More
go.
dentals.
Dentals all the
Everyone
time.
loves a clean mouth on their dog.
Oh,
right?
yes.
Stinky
Me
breath.
included.
Yeah, stinky breath is gross. That's why my dog's getting a dental today.
It is
The
gross.
breath stinks.
Because you told me that if their mouth smells, it's probably an infected
Bacteria.
tooth and bacteria.
It's bacteria.
It's not good. So, not even a question. Just get it done.
Just do it.
Yep. It's not even about the plaque. It's about the infection.
It's
Get it
the
done.
bad breath.
Yes.
Your pet feels better.
Absolutely. How many patients I see, I don't know if you've had a chance to see yet, but a lot of patients that have dentals and they come back and they're like, oh, I forgot that they liked to do
I
that.
haven't picked up that toy in
Oh,
so
I
long.
forgot that they picked,
They're
that
eating
they,
their food much faster, and I don't have to like quote, like, come on, you can do it.
Right.
Or feed them, or chew on a rawhide, or
there's so many people that do that.
So much happier.
And the symptoms are so subtle that disappear over time. And of course, some
Yeah.
of our patients are older that are having dentals.
Right.
So they, I think, attribute a lot of their changes to aging.
That's what I usually tell people is that because they'll say, "Oh, my pet's eating fine." I said, "Well, let's do it, and then let's watch afterwards, because that's usually when we see the difference. It's not that they weren't acting like they were sick before, but now they're acting like they feel so much better
right.
after their procedure. And usually they do say, "Oh yeah, wow, yeah, you can see the
Yeah.
difference."
Yeah, it would be cool to have like a dental suite. Wouldn't that be cool?
Yeah,
Yeah, see, that's something we could dream about.
maybe another X-ray machine.
Another X-ray machine.
The technicians would like that.
A dental
I
X-ray.
mean, if we're dreaming,
Okay, let's
big,
just dream big. Yeah,
let's
so
just
I
dream
think like
super big.
you have a whole separate department,
Yeah.
dentistry.
Dentistry department.
Do do do. Yeah, and then it's like you
And a
have.
CT department too.
Oh yeah, that's her dream is the CT.
Yeah, that's what she said. I was like,
Yeah.
I wouldn't know how to read that.
Oh
Get
gosh, that could get tricky, but that would be cool.
That
It'd be cool.
That would be very cool. Yeah, to have CT available.
You should get trained in laparoscopic surgery.
We should.
That would be cool.
That would be cool too.
I like that idea.
I don't think it would be
No, it's not.
playing a video game.
Dr. Kreider, where I worked for 5 years out of school, he did that. We did that brief, like I didn't do it enough before I left, but where you had to blow the abdomen up and all that. Yeah. Yeah.
Yeah.
Yeah, he was really into
I made
that.
up a game at this. So I used to help with the state fair, and I made this box that had a webcam inside of it, and then we put a
Oh.
big stuffed animal over top. And we had
Yeah.
laparoscopic tools, so the webcam would be playing, and you watch the screen, and then the kids could like do
Have to
activities.
try to do
That
it.
is so
inside
clever.
The dog.
Yeah.
So yeah, you could practice on something like that.
Okay.
She'll make you a stuffed animal.
She'll make me my
Make
fake
you-
practice
yeah, why
tool.
not?
Oh my gosh.
It was really cool.
That's so funny. Oh
You have
gosh.
to grab washers and like you could play tic-tac-toe, or you could throw like string in there and try to tie knots and stuff like that.
That's very cool.
It'd be hard to tie a knot.
Yeah.
Oh, I think it would be too. It's like I'm trying to. I know. I was just like, okay, if I was.
In there. Did they just use the clamps though, like the heme clamps, instead of like actual suture with knots? Like
Oh no, that wouldn't be so bad if you did
when
that.
you're doing it like at Purdue,
You just clamp it.
you're
With
like, I didn't do it. Yeah, just use like a heme clamp
yeah, that would be nice.
versus like trying to tie a knot.
Yeah.
Did you ever tell them about Wade? That was a cool surgery.
Oh no, we never talked about Wade. Are we allowed to talk about Wade?
Yeah.
So Wade is a he was like 8 weeks old maybe when you and Mary diagnosed him.
What? He was 6 or 8. It was at the time that the day after he started weaning. So I think he was like 6 weeks.
6 weeks, something like
Yeah.
that. He presented for regurgitation, right?
Vomiting, actually.
Yeah.
It seemed like he was just bringing up food that he had
Food.
just eaten.
So the breeder brought him in because she's like, all the other puppies are fine, and this one dog is vomiting or regurgitating. So we looked into it, and we took pictures, X-rays, right, to try and figure out why. Because your suspicion at the time, when that's coupled with weaning, was that there's something that's not working right with the esophagus. There's probably something, or at least it's been known to occur, that they could have issues with their esophagus.
Right, because they're able to get the milk down, but then they can't get the food down.
Right. It just seems suspicious,
Suspicious.
that the day after he weans, all of a sudden now it's a problem. Now, granted, puppies do crazy things. So
Right. So then you guys took an X-ray,
yeah.
and you're like, that looks unusual.
It's so weird.
And so, based on the X-ray, you were seeing some changes with the survey films. So,
Yeah.
like films that you just take, regular films. I don't know how to explain that, but just like regular X-rays.
Normal X-ray. Like
Normal
when
X-ray.
You think you broke a leg.
Yes.
But it's of your chest, not of your leg.
Yes. And then you saw suspicious things again. Your little suspicious radar was And so you said, you know what, this doesn't look right because the esophagus looks strange.
Yes.
And so then what'd you guys do?
So, well, Dr. Lehman was the one heading up this case, but she gave the dog something called barium, which is like a white paste that you kind of send down. And on x-ray, it appears bright white. And so you can actually see where it was traveling, and it created this nice little pocket right partway down the food tube, the esophagus. So
halfway to the chest, like 'cause the esophagus goes all the way to the stomach. So
Yeah.
as it's traveling through the chest,
yeah.
there was a spot where it was like a balloon, like you put a rubber band around a balloon. It was like you did balloon toys, and you were
Yeah,
you make a balloon dog, right? Yeah.
And then
And so then the barium was like,
it stopped right there, but then it eked by
Trickled
ever
it
so
through.
slightly. So, it kind of seemed consistent with something kind of constricting that area, as you said, a rubber band kind of in that region. And so the most common thing is something going on with the heart, because as puppies are born, there's little things that are supposed to go away and close and all of that. So
and not cause trouble anymore once
Yeah.
they're an actual puppy.
yeah, and so his heart did not form the correct way and left something behind that it wasn't supposed to.
So then we said, oh no, that's not good.
Oh no.
Oh no. So he's not going to be able to.
Gee, we need to do something about this.
And so we then said the breeder then knew what the problem was. She did some research on her own to try and figure out could she get the puppy fixed. And she was unable to tackle that, whether it be related to the cost, the post-operative care, all of it combined, I think was a little bit overwhelming. And so the call came through that could I euthanize the dog because he wasn't doing well. We were going to have to, we couldn't fix him. And I said, can I just have the dog? And so because we thought, well, I said, can I have the dog after I talked to MedVet and Dr. Hands at MedVet saying, hey, if I take this dog, what do you think? What are our chances of fixing it? And he sent a nice article and some good numbers, that helped us figure out, would it be possible?
Right.
So I went to Richie and I said, please don't make me euthanize a puppy. Can the foundation purchase the puppy? So we have All-Star Veterinary Clinic Foundation that will do certain things like the Harlow and other things, cases where we try and help patients.
Right.
And so he was like, sure, honey, you don't have to euthanize that puppy. And so that's not what he said at first, but that's what we're going to say he said. And so then I was like,
the end response.
that was the end response after much convincing. And so then Nancy was kind enough to give us the puppy, and then we were going to pay for the surgery. So then 2 weeks ago, he had a consultation with Dr. Hans, and he confirmed that, yes, based on our workup, that's probably what was going on.
The CT scanner.
And then did the CT scan. Yes. So then the next day he stayed for surgery, and before surgery he had to have the CT, and they saw that he had the vascular ring anomaly and maybe a persistent aortic. No, what did he have? He had something with a vascular bundle. There was something they thought
So he
might be
had
that.
a persistent right aortic arch, which is one of the types of a vascular ring anomaly, and then I think they were worried about his subclavian.
That's what it was. Yeah, the subclavian being involved.
So vessel off the heart that supplies blood flow. So it's important. You don't really want to get rid of it if you don't have to.
Yeah.
Right. He assured me there were lots of papers that if he did get rid of it, he didn't think that it would be an issue, but he really didn't want to get rid of it. Right. And so I was like, okay, let's not get rid of it if we don't have to. So he's like, but I don't know until I get in there. So then they took him from CT to surgery. He had surgery. It was just the fibrous ring, the band that basically was pinching the esophagus against the trachea so that it couldn't let stuff through, bigger particles through. And so he cut it, and now he recovered from the thoracotomy or thoracic surgery. And now we have to wait. Hans said we got to wait about 4 weeks to see if his esophagus will recover. It's possible that he could remain a persistent regurgitator.
Oh.
But he's
Baby
very
burden of
hopeful.
food.
Yep.
Right.
And so we're hopeful that because he's so young, he says the earlier you correct them in the research, the better off they do.
Yeah.
He had a couple of good prognostic indicators. The fact that he was so little, the fact that he didn't have a post-constriction bulge, so his esophagus behind wasn't also dilated. So he said that was a good prognostic indicator. And so then the foundation paid for his surgery, and he's in recovery, and APC is...
He's eating canned food.
He's eating canned food. He's slowly starting to gain some weight. I think it's gonna be great.
He gained a pound.
Yeah, he gained a pound in the past week. So
Maniac.
yeah.
Cute.
So APC, who's the person who does all the care and prior training, is kind of, I asked if she'd be willing to take on the project, and she said yes. And so she's really taken care of his care and done an amazing job, and is also working with him on his behavior and everything else. So he looks like he'll make a full recovery, thanks to everybody. But so we'll post more about that story because we think it's a fun story to watch. We've got, and he's super cute. He's got these eyes that look like I don't know. They don't look like dog eyes. It's weird. That one picture, did you see the one? Yeah. I mean, it's like he's staring at you like, oh, please, Jesus, don't.
Are you reading my soul right now?
Yeah, it's like serious. It's weird. But yeah, and then we've got pictures of the surgery. Dr. Hans was nice enough to share pictures of the surgery, the CT scan. So we're going to put a story together and then show it to everybody, or put it out there so everybody can kind of see about his case. But yeah, thanks for asking about that. That was he's a neat case.
He's a cool dog.
I think those cases all around, like not only for myself, who wants to euthanize a puppy, but for the breeder. The breeder doesn't want to euthanize a puppy.
No.
The staff member who's helping me with the euthanasia doesn't want to do that. Being able to do something like that helps, yes, the dog as well as all the people involved, is really cool. And I think the staff find a lot of, good in that. So it's kind of cool. Yeah, helps. And I think the med vet helped Dr. Hans. He's never done that surgery before.
Yes,
it makes him
super rare.
It's very rare. He's like, you're never going to see another one, is what he told me. He's like, it's a freak anomaly. Yeah. And he said that, he's never done one, so it makes him a better surgeon, which is better for our clients. Yeah. The better his technician staff is and his support staff. They had to manage that post-op, makes them better at that for our clients and everybody else's clients.
Like do something and have the puppy do better.
And
survive and have a good quality of life. It just helps your morale. You're like, oh yeah.
So I think for their staff too, they were pumped about it as well, being able to. And Harrison, you went to the appointment. You felt pretty good about. I mean, hey, anyway, so that's pretty cool. Okay, I think you think we should wrap up there, Harrison, with the time frame? Yeah.
On a positive note.
On a positive note. On a feel-good note. Okay. Okay, so.
Next time we'll have to have Wade come running in here.
Oh, we'll do that. I will. We'll have Wade do that. Harrison, anything we need to address before we wrap it up? No. Do you have any announcements coming next week?
No.
Nothing new? Online store is up and running.
Yeah.
Merch.
Check it out. We're going to add some dog jackets, I think, as we come into the cooler parts of the year. They're going to be pretty cool. Oh, yeah. I think people will like that.
Betty definitely needs
Betty needs one. Apollo. Can you imagine a jacket on him?
Oh, my gosh. All his huge mane around
a jacket.
Don't get his hair caught in the Velcro.
I know. He would be so fluffy on all aspects around the jacket.
Oh, my God. That'd be so cute.
He's skinny underneath that
fur.
He's tiny.
Yeah.
So.
Okay, well, that will be... Okay, so you guys were my first guest on the podcast. You guys did awesome.
Aw,
I'm so proud of you guys. So, I'm Dr. King, and look, we're getting tied up in quarters at even the end of the podcast. I'm Dr. King. This is the All-Star Podcast. Dr.
Dudley.
Dr. Cloud.
All right, thanks for joining me this week. And don't forget, send your questions to the... I can never remember, All-Star Podcast at gmail.com. ASVC. Harrison Branch, help me. God, you can remember and I can't. ASBCpodcast@gmail.com.
Kevin said the t-shirts are awesome.
Oh, Kevin. It's one of my cousins. You're so nice. He's always so supportive.
Are awesome.
They're super soft.
When are we getting ours? We need to rep some.
I ordered them.
They're on their way. They're going to be modeling them.
Well,
yeah, we should do little fashion show.
Oh, we should do a fashion show too. I think Sheila's got something in though.
I ordered long sleeves for the first round, and then the t-shirts are coming.
Nice, man. Nice.
Okay, there we go.
We are getting long sleeves?
Yeah, man.
There you go.
This place does love us.
I know you're super excited.
We work for the best place.
They have the sleeve text, and then they also have big letters, staff on the back.
Oh, so cool. All right, so that's it for this week's podcast. And, okay, the other thing we always do is, oh my gosh, I got to get my phone to operate here. So when we close out the podcast, we do it to music. So you have to dance in your chair. Okay, are you ready?
Oh, she's already jamming.
Oh, I know, she's ready to go. Okay, everybody.
What song's in your head?
Baby Shark.
Baby Shark. Da, 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 da. All right, everybody. Thanks for joining us this week, and we will see you next time. This is my leg. my go-to.
This is what you do in the car?
Yes, while I'm driving.
Just one hand.